Hello, everyone. I have a wonderful patient of mine. She is 5.5 weeks out from her surgery, and you had 400 cc implants, what is below the muscle, done by a board-certified plastic surgeon below the muscle. Now, I have to say, if you have had a good plastic surgeon, trust me, my job gets easy because he did it right or she did it right, and the results are better, easier because it was done right to begin with. Now, let me ask you this. You're 5.5 weeks out. How do you feel post-explant now versus when you did, like, say, 6 weeks ago when you had the implants?
I'm feeling great. I have definitely more energy. I'm sleeping better, skin's better, bowel movements are better. I am feeling just completely, honestly, like a new person.
You know, how much better are you compared to, let's say, 6 weeks ago when you had your implants?
Oh, I mean, I'm 100% better. I feel like I'm honestly a new person.
Right, right. And you know, you went back to work 3.5 weeks. You work at the hospital. Now, let me ask you this. You said something very interesting. You were potentially going to be covered at a major hospital here in Detroit, and they were going to, this was going to be a fraction of a cost, almost a third less.
Yes.
Right? And you opted to come with me. Why?
Well, I started to do more research. And I was offered they were only going to take out the implant, but once I did my research and saw that you really needed that whole capsule removed, I just decided that I need to go to the best surgeon that I could find, and that's Dr. Khan, and I'm so happy.
No, thank you. How much research did you do on me?
I spent, honestly, a year.
Very good.
Yeah, looking this stuff up before I made a decision.
Were you questioning yourself or kind of like having second thoughts about proceeding? Or
it was more like I was worried. I did not want to have a surgery and then I didn't do the right thing. And have to, deal with something in the future again. So it was more like I wanted to make sure I was extremely confident in what my decision was.
Got it. Okay. Now, next question. As you can see, clearly you did not need drains.
Right.
And did you need a lift?
I did not.
Yeah, and you are, for someone 40 with 40 years of age and 400 cc implants, those were relatively large for your chest width, and I have to say that you clearly did not need a lift, and you have yet to improve. So between the recoiling of the skin, the breast tissue, the fluffing effect of the breast tissue, now that you don't have a foreign body pressing against the implants are going to fluff out. The breast tissue is going to fluff out as the implants are no longer there compressing the breast tissue. So this is very much proven. You're going to see the inflammation is going to subside as you wean off the compression. The breast tissue is going to fall out more and it's going to not be compressed. And between the 10, 15, 20% muscle mass you add to your chest, a year and a half later, aesthetically, you're going to be only improved. Now, how was your anesthesia experience?
Great. And I had a horrible one with my augmentation. So this time, I was drowsy, but it was great.
Yes.
I had no problems.
Right. Now, what's interesting is you had said to me initially that you thought your symptoms were not as bad and this was just part of the aging, because
right.
This kind of came to you as a surprise. We went over some of those check boxes and you had not even checked them, and those improved.
Right.
And you thought this was just you. And see, I say that this is such an evil disease where you think that's just part of the aging process, your workload and your schedule. And lo and behold, this was the underlying implants.
Right.
Now, most common symptom is fatigue, and so we'll continue to see how you're going to improve over the next year and a half. Now, let me ask you this. As you went into the surgery, did you know that you were going to improve?
I did not know what to expect. I was researching things, and I was on a Facebook group, an Explant group, kind of reading what people were saying. So I was anticipating, hopefully feeling, an improvement. Especially in my energy, so I was expecting kind of something, but I did not expect it to be to this degree. I feel like it's much better than what I had thought that it could be.
Sure. Now, do you think this is a placebo effect in the last 5.5 weeks?
No, because I'm seeing like actual tangible things like that are definitely like physically different. So I would have to say no. Even my husband's noticed a difference, so.
You mentioned the throat clearing, very common.
Yes. I felt like I just always had postnasal drip or something. It was just a sinus issue, and it's gone. So.
Right.
Yeah.
So now, thanks for sharing your journey. You have been extremely compliant. I appreciate that, and truly an exemplary patient. Thanks. See, the take-home message, you're welcome. The take-home message is do your homework. Do it right. Do it once. Follow your gut. You will know. This is a surgery where if you follow along with insurance does not want to even look at anything. The doc was not going to remove the capsule, and you knew better, right? Now, I will tell you, you work at the hospital and the medical field. I don't want to say anything, but we all know patients who have employed by the hospital or work in the medical field. We know all the ins and outs of what it is, the politics and the financials of working at a medical institution. So we won't go there. Anyways, thank you very much for sharing your journey, and God bless you. Take care.
Thank you. You too.
You're welcome.